Tonight, it's Live with Vince Elliott. Live with Vince Elliott. Tonight on Live with Vince Elliott, we're focusing on the optometrist that might get you 2020 in 2020 and beyond. Dr. Tiffany Zarielda. And keeping the show on track, co-host Erica Mack. Erica Mack. Who's the Mac? Let's get it.
Good evening. We're back once again. It's a Tuesday afternoon. I am Vince Elliott.
And she is Erica Mack.
I love the way you talk in third person. She is.
I just thought about it. I said, you said it's Tuesday afternoon. And I was like, no, it's Tuesday evening.
I said Tuesday evening.
You said
Play
afternoon.
the recording back.
Play it back.
Anyway, welcome to Live with Vince Elliott. We are looking so forward to today. We're going to have a great time as usual. If you missed last week, you and you need to go to YouTube. And what they need to do, Eric?
Go to YouTube and subscribe to the Vince Elliott on YouTube. That is, subscribe to the Vince Elliott on YouTube. We are here every Tuesday at 8 p.m. Make sure that you turn on your notifications, that you are reminded that we're on at 7:55 every Tuesday. So go ahead and like that. Click the like button and also share. Make sure that you're sharing with your friends and neighbors.
Yeah, because we're always giving, what I really like about the show is we always give really helpful information that can actually impact your life, whether we're talking about health, whether we're talking about finances, whether we're talking about what's going on in the world. It's always something that is going to benefit you. And so we just want you guys tuning in every week so you don't miss anything. Plus, we're going to start doing some special things. I'm just going to tease you a little bit, but you're going to have to subscribe in order to be involved, because we're going to be doing some giveaways and stuff like that. If you're not a subscribed viewer, you will not be able to participate. So you want to make sure you do that. In the meantime, how was your week, Erica?
Actually had a really good week. Things are looking up, and so that was really good. And then the weekend was pretty good. I got to celebrate some birthdays with some friends, so that was pretty awesome, and I enjoyed that. So, yeah. Oh, we went axe throwing. That was one thing we did this weekend. That was like my second time doing that, so that's a pretty fun activity. I suck at it, but I'm growing in grace.
How concerned should I be that you're learning how to throw axes, and why are you learning how to throw axes? Is what I want to know.
You don't have to be too concerned. Know that I do not use one, but you don't have to be too concerned.
It's always something, man. Erica, the adventurous, but listen. So my week, I don't know if it was extremely eventful, but one thing did stand out. I talked to my father, my family and I, we talk to our father every week, and, we get together on the phone or on a live or something like that. And one of the things he mentioned, now he's 87. That's what you have to know, right? He's 87 years old, and he's like, you know what? I think I'm gonna go get me a job. And we were all like, no, no, because I come from a long line of workaholics. Him and his brothers and all of that. And so he's 87 years. So I'm telling him about the story that you shared in other news the other week, where you were talking about the 89-year-old man who was delivering a pizza.
Pizzas, yeah.
I told him about that. He was like, I need to go deliver pizza. Because if you didn't hear the story, they gave this man, they raised money because his Social Security wasn't doing right or something.
Right.
And so they raised, the tip was like $12,000 or something like that, was it?
Right.
Yeah, so when I told him that, he was looking for a pizza job.
That's funny. That is awesome.
Yeah. So look, without further ado, unless you got something else to talk about on the week.
No, that was my week.
I want to let you guys know what's coming up today. So first of all, you guys need to go ahead and comment or get ready for your comments and questions, because today we have an optometrist on the show, and she's going to be talking about eye health. Now, what's interesting about this is she's going to be talking about how you can detect what's going on with the person just by looking through their eyes. get ready for I ain't gonna even tell you her name yet. I'm waiting to introduce her. In the meantime, y'all know what time it is. It's time for In Other News.
And now for news you may or may not be able to use. News other than Trump, COVID, or civil unrest. It's In Other News. Live from one of our remote studios, it's news anchor Erica Mack.
Erica, what's going on in other news?
Well, welcome back to another week of In Other News. In other news, we have a woman becomes a provider at the same hospital she used to clean. So 10 years ago, Jane Andretti became the nurse practitioner. Let me back that up. 10 years ago, Jane was the cleaning person for the hospital that she is now a nurse practitioner. So she went from the cleaning person to a registered nurse to now she's the nurse practitioner. So, what you about to say?
I was about to say, there's two sides to this story, all right?
Yes.
Your perspective. Now, first of all, I'm very pleased to see someone, work their way up, from the bottom and all that type of thing. I mean, I don't think there's a lower position. When I say lower, I mean, like in terms of pay, right? And authority. So you're working, you're mopping the floors, you're cleaning, you're spraying, and then next thing you know, she moves on up and she's taking care of patients. Now, if I were, say, a regular patient and I had seen her as the cleaning person and now she wants to come in and start, diagnosing me, I'm going to have a problem with that.
I can't.
Because I don't know. I mean, wait, you was just cleaning, and going and cleaning, mopping and everything. And now you're in here trying to diagnose and give me. So that's probably going to be a little unsettling for the regular patient. I don't know why you would be a regular patient.
So you don't believe that she would have to go through the criteria and things such as all other entities of the hospital?
I'm not saying that she wouldn't. I would just be questioning it. And for my money and for my health, I may request a different provider. That's all I'm saying. I'm just saying. I don't know if the person who I'm a discriminate.
What I hear you saying is that you don't believe people can work their way up to the top.
See, now you putting
starting
words
from
in
the
my mouth.
bottom and moving to the top.
We're in a political season. I'm going to give you a political answer. So, let's move on to the next story because it doesn't sound like it's going in my favor. Congratulations to her anyway.
That was pretty awesome. That never give up.
Yeah.
Your dreams never die.
Well,
and so our next story is 12-year-old makes history as the youngest student to study aerospace engineer at Georgia Tech. So 12-year-old Caleb Anderson is set to transfer from Chattahoochee Technical College in Florida to Georgia Tech. He's pretty much a genius. There's not pretty much to it. He is a genius.
Right. I was going to say.
He's been reading fluently since he was 2. And by the time he was 11, he told his mother that he believed he was ready to go to college because regular school was not preparing him for life.
Wow.
So he is now a sophomore heading to Georgia Tech, University. Yes.
Do you know how that has to make his classmates feel? I mean, this guy is 12 years old.
Exactly.
There's so much. I mean, he's not even fully developed as an adult yet, and he's sitting in class. And so now, how dumb do you feel when you're in class and they're asking a question and you don't know the answer and he knows the answer? He's like, oh, yeah, let me break that down for you. I don't know how I'm gonna feel about that. I'm gonna have to switch classes. Maybe he gonna have to switch classes.
Or just maybe you become his friend and become his study mate, and y'all work together. Then two people together, birds of a feather flocks together. So then people look at you just as smart. That was a smart move.
Maybe I could bring him some candy or something. Some little kitty candy, and maybe
he's 12. He probably doesn't eat candy.
And bring him a video game or something. Anyway, yeah, that's pretty awesome though. I do like to hear the stories when people are doing great things, coming up and just exceeding despite all of the challenges that we have, in our system and things like that. So that's great news to hear. And you said he's at Chattahoochee. Where is he? It's
Chattahoochee.
Chattahoochee.
I know. And it's so funny because my godmother is from Chattahoochee, Florida, so I knew exactly where it was.
Oh my goodness! Well,
Chattahoochee, yes.
Well, listen, we're gonna move on from that because I don't know who's naming these places, but anyway, we have a great show for you guys. Listen, like I said, get ready with your comments, your questions. We're going to be talking to an optometrist. Yeah, I'm going to introduce her really, really soon, let you know all about her. I want you guys to let me know where you're watching from and all that type of thing, and ask her anything. You can ask her any types of questions as it relates to eyes, and she will do her best to answer because she's a professional. She's an expert. She's a master in her field. So we'll get to talk to her right after this. Hey everybody, it's Vince Elliott. Thanking you guys for your support. Thank you for tuning in, watching Live with Vince Elliott. Just want to take a moment out to say we appreciate you. We appreciate you subscribing. We appreciate you sharing with your family and friends. We want to continue to bring you content that's going to be helpful to you. We bring on experts, people who are knowledgeable in their fields of study, all different types of variety of shows so that we can bring you something that's going to be great for your life, whether it's information, education, inspiration, motivation, or just a few laughs. So we want to continue to do that, but we need your help. And so what we're asking is that...
Hey!
Oh.
What's cracking?
Come on, man. We don't have time for this.
Oh, go ahead. What were you asking?
All right. If you must know, we're asking people to give $1.25 a week.
$1.25? Why so little?
Because times are hard. People don't have a lot of money. Some people are unemployed. So we're only asking for $1.25 a week.
Well, how many viewers do you have?
Well, it's, anywhere from 150 to 300 people that are watching live every week. And then with the replay throughout the week, we might sometimes go over 1,000 people.
Oh, you know what this means, don't you? Huh?
Yeah, I know what it means. I just said what it means. It said times are hard. People
No,
are unemployed.
it means that your show sucks.
You know what? All right, that's it. Get out of here, little V.
Oh, come on.
Oh, come on, nothing, man. You can't be saying my show sucks. My show doesn't suck. We have a great show. People get value out of what we do.
Okay, if you have hundreds and sometimes over 1,000 people watching, they're going to give $1.25 in a week. Your show has to suck.
All right, that's it. I don't have time for this foolishness. I'm not putting up with this. Ladies and gentlemen, I'm so sorry about little V. Listen, thank you for those of you who have supported. Thank you to those of you who will support. We got to get back to the show. I can't believe you, man.
You don't know nothing.
Get out of here. Let's get back to the show. Can't believe it. I apologize once again, ladies and gentlemen. Lil V is out of control. If you're new to the show and you don't know who Lil V is, he's that voice in my head that's always trying to get me to say and do things that I'm not supposed to do. Everybody has their own Lil V. Erica has a little E or whatever you call her, a little Mac. In the meantime, let's get right to it.
Somebody there.
Without further ado, I want to introduce my guest. My guest tonight is an optometrist who graduated from the College of Optometry in 2010 after receiving her bachelor's from Oakland University in Health Sciences. She is one of the few providers in Michigan that fit using iPrint prosthetics and has trained extensively in fitting medically necessary contact lenses in toddlers and infants. She takes pride in helping each of her patients to see as clearly as possible, and she not only fits specialty lenses, she also provides comprehensive eye exams, diabetic eye exams, diagnosis, and treats glaucoma, macular degeneration, and dry eye. She is a member of the Michigan Optometric Association and American Optometric Association. Please welcome my guest, Dr. Tiffany Zare Yelda. Come on. And she likes the music. She likes to, they say she likes to groove a little bit, so we turn the music up. Yeah, you showed your lack of rhythm there. You were just like, I mess with everybody. You got to know that. How are you? Thank you for joining the show. How are you doing?
Very well. How are you guys?
Listen, we are so glad that you decided to join us on the show. You're the first person that we've had on the show who is an optometrist. So this ought to be interesting. We talk about all types of things. We talk about all types of health, natural health, medical, all those things. But to talk about eyes is a first on Live with Vince Elliott. So we're looking forward to everything that you have to say.
Thank you.
Before we get into it, I just want to allow you to say whatever you want to say to our viewers and just, kind of introduce yourself.
Yeah, thank you. As Vince told you, I'm Dr. Tiffany Zarielda. We have 5 locations, and out of all the locations, we do comprehensive eye exams. We treat dry eye, diabetic exams, specialty contact lens fits. Our Novi location specializes in pediatrics, infants. Recommended eye exams start at 6 months old, which is something most people don't know. So I'm just excited to be here and hopefully can answer all your questions.
Absolutely.
Awesome.
Well, Erica, I think we should get right into it. I think we should drill her with, she better be able to, no, I'm just kidding.
All the hard ones.
All the hard, give her all the hard questions. Like, why do I get that crust in my eye? Things like that. So why does my eye get that bump on it periodically and flutter? And sometimes I feel like something popped in my eye. I have all types of questions. So before we get started, I just want to remind everybody that we are looking for your participation. We want to know, where you're watching from, but more importantly, we want your questions and your comments for Dr. Tiffany Zarielda. She is here to answer those questions and maybe give you some insight that will not only be helpful for you, but, hey, you can check out one of her 5 locations. So you can get the help you need. So that being said, Erica, fire off. What do we start with here?
You actually just started with a couple of good ones, definitely about the little bump in your eye. But before we get to that little bump, because I get those periodically and they go away. But yeah, before we start with that, what are like different myths that we hear about the eye and the eye? Yeah,
misconceptions.
Yeah, I think some of the most common ones are glasses made my eyes worse. Glasses do not indeed make your eyes worse.
You must have heard me say that.
Yeah. So, yeah. What actually happens is we don't realize how blurry we actually see and how clear it should be. So once we put those glasses on, we see that clear difference. And it's not that it made it worse. That's how poorly you actually saw.
Wow.
So, yes. And especially with reading glasses, our eyes do not become dependent on them. It's an age-related change. I don't want to say unfortunately it happened, but it's a good thing. This had enough birthdays.
This one's personal because I prided myself on my 20/20 vision, and then all of a sudden, this was years ago. I was working for one of the big 3, auto manufacturing companies, and all of a sudden, they had these big, where they have all the statistics and what's going on the LED screen, and I couldn't see the green colors, and I'm like, so I'm rubbing my eyes like, what? I can't see. Maybe I had something in my eye. So I ended up going to the doctor, and after he did the test, he was like, you need bifocals. I was like, bifocals? Oh man, you need to give up your license. You have no clue what you're talking about. No way I need bifocals. I'm the guy with 20/20 vision. And so, and then the other thing is as a kid, if you had bifocals, you were teased because bifocals were like this 3-inch thick glass. So I wanted no part of that. So that scared me when he said that. But long story short, to your point, is when I began to wear the glasses on a regular basis, then it seemed like after I took them off, it was worse than it was before I started wearing the glasses. And I was like, I'm going to wear these glasses as least as possible because they're making my vision worse. So I'm glad you cleared that up. And so, I'm going to be interested. We'll finish talking about myth, but I got some other questions for you.
A lot of people really believe that too, what you just said, Bit. So
I think it's the most common thing that we hear is these made my eyes worse.
Yeah.
Didn't really make them worse, but okay, let's talk about it. And especially with the reading, kind of like you said, is you kind of hit between 40 and 45. You wake up one day and you can't read anymore.
Wow.
And, you start doing one of these, and I like to call it T-Rex syndrome. Your arms are just not long enough anymore. So it's time.
A lot of things happen when you wake up between 40 and 45 that you weren't used to, but we won't go into that. So are there any other major, really popular misconceptions?
Yeah. So another big one, they kind of go hand in hand, is that I don't need to go to the eye doctor. I see perfect. So that's another big one I hear is we have patients 40, 50, 60 years old. Well, this is my first eye exam. I have perfect 20/20 vision. And what we say is, okay, you may not need glasses, but you do need to go to the eye doctor. There's so much more we can see in the back of the eye. So it's a whole health check. It's not just we need glasses, we don't need glasses. So that's, something we hear probably just as much as the glasses made my eyes worse is I only need to go to the eye doctor if I can't see. And that's probably one of, I'd say probably the worst things that we can hear.
Man, there are so many eye questions. Go ahead, Erica. I got 1,000 questions.
Well, it's interesting. Like you just said that before I start coming to you, some years ago, I had gone to a very popular brand company, and they told me that I didn't need to come back because it was like, the first they told me, let me just say this, I'm about hitting my my yearly or bi-yearly appointments on everything, dental, health, everything. I don't miss a mark. They were like, "Oh, you're calling ahead of schedule. It's okay. Schedule me anyway." But but they told me that I didn't need to come back because I wasn't having any issues with my eyes. And so, is that true?
Once a year is what we recommend, unless there's something else going on in the eyes, or unless we're seeing larger changes that could indicate something else going on. But once a year, yes, but not to come back unless you start having issues. No.
Well, yeah, I mean, I'm looking at the comments here, and it says, I've been seeing Dr. Zare Yelda for years. She is knowledgeable and truly cares about her patients. Oh, that must be your sister. No, I'm just kidding. I saw the Z on the end there. But
but with comments like that, come on over.
Right. So let's get to some of these questions that are already coming in here.
Yeah, let's go with C. Taylor. He says, my eyes water a lot. I was told it was dry eye and that I should use eye drops. That doesn't make sense to me.
Yeah.
So that's a great question, actually. Sorry, Vince, go ahead.
No, I was just gonna say, my father had the same issue, and now I have the same issue where my eyes water a lot.
Yeah, so it's actually very true. That does indicate dry eye. What actually happens is the eyes get so dry, they start to produce too many tears, and that's when they start to water down the face. So if the eyes are watering down the corners of the eyes, that is an indication of pretty severe dry eye. So it's not just the beginning stages at that point.
And that's what I'm trying to explain to my family. When we watching a movie, they think I'm crying. I'm going, no, I got dry eye. I'm not, just because the character got killed.
Depends on the movie, yeah.
I'm crying. Okay, no, I'm just kidding.
So drops regularly will help that. It really depends on the type of dry eye you have. There's different types. There's lipid deficiencies, aqueous deficiencies, and depending on the type of dry eye would be how we treat it. There's different treatments that we can do in office that are not, something you would do at home. So one is called the tear care, which we actually put little probes on the eyelids, and it almost massages those glands, because what happens is those glands get so capped, the tears can't get produced and pushed out of the eye. So it massages those. We're able to express the glands, and you have, really good relief for usually 18 months, a year to 18 months, if not longer. But if the eyes are watering, I would definitely follow up on that.
Well, that's very interesting that the eyes would water from being dry.
I know, right? That's
so I understand concern. Like, how can that make sense?
Yeah. So Michelle says, what's the best way to monitor my eye health between visits?
Yeah. So the big thing you want to watch out for is sudden changes in vision. If you wake up one day and you go, gosh, this just doesn't seem the same as it did yesterday, or even earlier that day, then that's an indication that you want to come right in. Also, painful eyes, red painful eyes. So anything that's not your normal is definitely of concern. A lot of eye diseases have no symptoms at all. So you'll never know it's there. The only way for us to know is to actually see it. So very, very commonly, we have patients with glaucoma, cataracts, diabetic changes, and the patients, I'm fine. I can see. I haven't seen my eye doctor in 10 years. And at that point, there's already permanent vision loss. So
Wow.
I would say, yeah, anything that is abnormal that doesn't seem like it did the day before or the hour before needs to be followed up on.
So getting those yearly checks are important.
Yes.
Yeah.
Yeah.
A lot of times, we're scared to go to the doctors. We don't want to hear anything. We don't want to hear anything bad. So no news is good news.
Yeah. So we'll avoid it.
See, Taylor, what's she saying, Erica?
Do dollar store glasses help or hurt?
Yeah. So it depends on your prescription. Dollar store glasses are a good option for, I want to say, a small amount of patients. They really just help correct for your reading. The big things with the dollar store glasses, it's the same prescription in both eyes. It's not specialized for you. It's kind of like buying a retainer from the drugstore, and you put that retainer in your teeth and go, it kind of fits, but not really. That's like the dollar store glasses. They kind of work, but not really. If the power is too strong or not strong enough, it can cause more eye strain. It won't necessarily hurt you, but eye strain is going to start to cause frontal headaches, ocular migraines that go back into the head, things like that. So I would say just be really cautious. Sometimes I do recommend, the over-the-counter dollar store glasses for patients and say, you see great, this is all you need. But a lot of times the eyes are not the same. So we end up saying you'd really benefit from something specifically tailored for yourself.
There's a comedian, and I can't call his name, but when I start talking like him, you'll probably know who I'm talking about. His whole spiel is he talks like, yeah, so, I was walking down the street. I wear glasses and my prescription ran out. And it was like, I couldn't see a thing, and I'm like, I never thought about something like that. It's like, at some point your prescription is not as effective as it used to be. But, of course, he exaggerated the deal, and like he was just walking, he could see fine, and his prescription ran out. He couldn't see a thing. So, I thought that was pretty funny.
So going back to the myths, a lot of patients will say the prescription ran out of my glasses. They will say that to us. And I always say, we put the prescription in the glasses. It doesn't run out or change. It's your eyes that changed. So It's not that the glasses don't work necessarily anymore. They don't work because your prescription has changed or there's something else going on in the eyes to cause them not to work. But those glasses always will have the same prescription in them.
Okay. Well, Spec says, can migraines be caused by eye problems?
Absolutely. Eye strain is a big thing that can cause migraines. We actually have, a formal diagnosis, as you want to call it, ocular migraines, where you get that visual aura, get that disco ball feeling. All patients say, I thought, I was at a club, or I thought I was having a stroke, because they see that visual aura. And that migraine can come with that. It can come without it. But eye strain, wearing the wrong prescription, one that's too weak, too strong. We get a lot. I'm wearing my husband's glasses. I'm wearing my daughter's glasses. That all of that can cause pretty severe migraines because, it's not for you. So you're just straining to see clearly through that.
Yeah, I went to get an eye test when I was getting these glasses. And you don't see them, but I got some glasses over here. And so I was, it was testing to see what strength I can use. And the one that was a little too strong, it was just like, oh, no, I got to take these off. And so I knew if I'd have left with those, I'd have been messed up with migraines and headaches. Yeah. But I want to jump to something real quick because, we got more questions in here. But the question, or it's not even a question, the comment that jumps out the most to me, I got to put this one up because there it is. Hello, Mom.
Hi, guys.
So, there's that support from the family. Erica,
funny.
Go ahead. What do you got?
We'll go ahead and continue with the questions. Naomi asks, what does it mean if your eyes stick a little bit? Example, I blink one eye, take a little longer to open up.
So if you actually feel them sticking on the front of the eye, it could be one of two things. It could be the start of a bacterial or viral infection, or it could also be dry eye. If one lid lags a little bit more than the other one, then we'd want to do kind of more of a neurological workup, make sure that there's nothing going on neurologically to cause a lid to lag that didn't lag previously. But if it's more of that sticky feeling, it's going to most typically be a dry eye issue as well.
What are things that causes dry eye?
Yeah.
So there's a laundry list. The most common, living in Michigan, we get the humidity in the summer, the dry wind in the winter, the allergens. If you work or live, if your house is a dry environment, your work is a dry environment, people who work in the hospital, it's just very dry there. Medications, age, gender, there's such a laundry list. And when patients will say, well, what's causing my dry eye? I always respond with, unless I follow you around all day, every day, I can't tell you. But these are certain things that can, and typically we can check off of that list at least 4, 5, 6 options that, that patient is exposed to. The heat blowing in the face, in the winter in the car, the air conditioning in the summer. So I always just say Michigan's a little bit of a harder state here because we have so many environmental allergens as well as everything else going on inside. So,
yeah, go ahead.
So we should just walk around with Visine.
Yeah.
No.
Visine is not a supporter of the show.
I know.
They do not get any free plugs.
I know she doesn't like Visine. Go ahead.
You know better. Yes. Visine makes that redness worse. So I know those eyes look nice and white and pretty for a couple minutes or a couple hours, but those blood vessels get squeezed nice and tight. No blood can flow through. When those blood vessels open back up, they're larger than when they started. So your eyes are going to be even more red. You use more Visine. So it's just this kind of hamster wheel effect where you have to keep using it. So that's where we're going to talk about artificial tears.
Wow. All right, let's go to Todd. Todd says, I work on a computer. Sorry about that. That's my fault. I work on a computer all day. Sometimes my vision gets blurry or I get tired eyes. By the end of the day, are there non-prescription glasses that could help with strain, or could I use drops?
Yeah. So we have what's called the 20/20 rule. Every 20 minutes of work on that near device, you want to give yourself a 20-minute break. Look away. So you don't have to necessarily stop what you're doing, but look away across the room, out the window, at a clock, blink a few times. That's going to help with the tired eyes. Using drops when we actually do forget to blink when we're on the computer. So there's all these studies that show we don't blink. Blinking is what helps the tears wash across the front part of our eyes. So yes, you can use some artificial tears, and that will kind of help you to remind you to look away from the computer or at what you're doing up close. In terms of non-prescription glasses, there are certain glasses that are used for near work, and they do help relax the eyes up close. So, two kind of very different things in terms of the dryness, the drops, giving yourself a break. And then a lot of times we do for people who work on the computer all day or who have multiple computer screens, we do recommend certain glasses that do help to just relax those eyes, and they will notice a significant improvement by the end of the night.
Is there a, I assume the answer, but I want to ask you as a professional, is there a significant increase in the degeneration of eye, of vision, now that everybody's on smartphone and computers and iPads and on and on and on?
Yes.
Yeah.
So with all the near work that especially children are doing, we're seeing an increase in myopia or nearsightedness. So it kind of used to be very average there, and we're definitely seeing that spike up. So we're really being diligent with parents, especially at this point, saying you really have to bring your kids in. Any sign of squinting, not reading, words moving on the page, anything like that, you have to bring them in right away. But we are seeing an increase in nearsightedness because of all the near work that we're doing.
Now, what's funny? So I was a kid in the 70s, and I used to feel like, I remember this, I was old enough to remember this. I used to feel like there was air in my eyes. I mean, I really believed there was air in my eyes. That's how it felt. And I used to try to squeeze the air out. And so I mean, even doing it now, it's taking me back. I used to do this a lot, blink a lot, because I was squeezed all the air out of my eyes. And because I blinked a lot, my parents, of course, being the loving parents that they were in the 70s, took me to the doctor and got me some glasses because I blinked a lot. And and then after I grew out of that blinking, it was like, I don't know. I mean, is that even a thing? Should I have gotten glasses because I was blinking a lot?
So sometimes it's a nervous habit for kids to do that blinking. So we do get a lot of younger kids and the parents say they blink or they squint or they do these weird habits with their eyes. So it probably prompted them to take you to the eye doctor, but I would guess, I wasn't there at the time. The glasses were not necessarily just because of that. It was more, hey, he really needed them, but it was, and I would say those little, weird habits that kids have are sometimes a good thing because they prompt the parents to say, this is not something he used to do. This is not something that any of our other kids do. Let's go ahead and bring them in when they otherwise wouldn't have. The funny thing with kids is they don't know when they hit blurry vision. They don't know when to complain. This is normal for them. This is all they've ever known. So in order for a kid to actually complain, it's typically because they failed a school screening, a pediatrician screening. Teachers are noticing squinting or poor grades. And most
are they still doing that?
Exam.
Are teachers still doing that?
Yeah, okay. We get a lot of referrals from teachers, where parents will say the teacher recommended we come in. They weren't doing so hot in the back of the room. They got moved up to the front and now they're a straight A student. Or they're, a big thing is if the kids are behind in reading, a third grader's reading at a first grade level. And that's because those eyes are not focusing a lot of times. So we
or
can
their
do
behavior is off.
Yes. Yep. Behavior is a big one. Sometimes too, they think kids are dyslexic, but it's actually just the eyes don't focus. And as soon as we strengthen those eye muscles, help out with glasses, vision therapy, things like that, we see them excel. They go from CD students to straight A's.
Wow.
Yeah.
I know she saw quite a few of my students. They was like, I don't need these glasses. She used to counsel them into glasses.
Bit more broken glasses from Erica's students.
And they're right back getting some more glasses from you.
Yes. Let's go to Elaine. Elaine Ross asks, I missed the introduction, but this is her problem. I have chronic inflammation following eye surgery 2 years ago with no improvement after injections. Any recommendations?
Yeah. So, with inflammation, I'm assuming, Elaine, you mean in the back of the eyes, very typical after laser surgeries or cataract removal. Not typical, but that's typically when we would see it the most. I would say just stay hopeful. The eye injections are typically what's going to help the best. They're going to slow down any additional swelling, any additional bleeding that can happen. I always say if you don't feel like things are getting better, then, we can explore other options and see if there's something else going on in the eyes that's, causing poor vision. But it really depends on what kind of edema, swelling you have and what kind of surgery you had that is causing this now.
Now, so as an optometrist, you don't do surgery. It's the ophthalmologist that does surgery, right?
Correct. So we as optometrists do the same exact eye exams. We prescribe the same medications. We treat the same disease. We treat everything the same. The only thing we do is we don't do surgery. So as soon as you're ready for surgery, we'll send you over to the surgeon and they'll send you right back into our office. We do the pre-op, the post-op, all the care. We work hand in hand with those optometrists, those ophthalmologists. So that's really the only difference though. It's the exact same exam, care, medications, everything else that you need.
Okay. Now, are the optometrists, you know what I'm trying to say, optometrists, ophthalmologists, that's what it is. Ophthalmologists. Are they within your 5 locations or these are just partners?
We work very closely with them. They have their own locations, some real close, some, depending on exactly what you need. But we do work very closely. They don't come into the office. They work out of their own locations.
Okay. Well, ladies and gentlemen, that was a mouthful already. And we still got a lot more questions. You're not off the hook yet. We got a lot more we want to know about. So if you're just joining us, we are with Dr. Tiffany Zare Yelda. She is an optometrist, and she has 5 locations to serve you. We'll be talking about that a little more in the show as we get further into the show. So you and where her offices are, and she's spread out, so you can get to her wherever you're located, and then we're going to come back and ask about things I want to know about too. Is like these glasses are fogging up when I'm wearing these masks, man. What can I do about that? I expect her to have all the answers for all the eye questions, so when we come back after a really short break, so don't go anywhere. We're going to ask a bunch more questions. You guys get your questions and your comments ready, and we will, we'll address those. In the meantime, I want you guys to remember that we need your support. And so I put the Cash App there up on the screen. You can go to Cash App, and you see it like it says $ live with Vince Elliott. Notice that there's 1 L and 1 T in Elliott. Traditionally it's spelled with 2 L's and 2 T's. So if you do that, then it'll go to the right place. So be sure to support, because we could use that in order to keep this show going. No amount is too small, and definitely no amount is too big. And so you can also email us if you should desire with your questions, comments, or if you want to know another way to support the show, you can email us at thevinceelliott@gmail.com. And so, let's take this short break. We'll be right back. Hey everybody, it's Vince Elliott. Thanking you guys for your support. Thank you for tuning in, watching Live with Vince Elliott. Just want to take a moment out to say we appreciate you. We appreciate you subscribing. We appreciate you sharing with your family and friends. We want to continue to bring you content that's going to be helpful to you. We bring on experts, people who are knowledgeable in their fields of study, all different types of variety of shows, so that we can bring you something that's going to be great for your life, whether it's information, education, inspiration, motivation, or just a few laughs. So we want to continue to do that, but we need your help. And so what we're asking is that...
Hey!
Oh.
What's crack-a-lackin'?
Come on, man. We don't have time for this.
Well, go ahead. What were you asking?
All right. If you must know, we're asking people to give $1.25 a week.
$1.25? Why so little?
Because times are hard. People don't have a lot of money. Some people are unemployed. So we're only asking for $1.25 a week.
Well, how many viewers do you have?
Well, it's, anywhere from 150 to 300 people that are watching live every week. And then with the replay throughout the week, we might sometimes go over 1,000 people.
Oh, you know what this means, don't you? Huh?
Yeah, I know what it means. I just said what it means. It said times are hard. People are unemployed.
It means that your show sucks.
You know what? All right, that's it. Get out of here, little V.
Oh, come on.
Oh, come on, nothing, man. You can't be saying my show sucks. My show doesn't suck. We have a great show. People get value out of what we do.
Okay, if you have hundreds and sometimes over 1,000 people watching, they're going to give $1.25 in a week. Your show has to suck.
All right, that's it. I don't have time for this foolishness. I'm not putting up with this. Ladies and gentlemen, I'm so sorry about little V. Listen, thank you for those of you who have supported. Thank you to those of you who will support. We got to get back to the show. I can't believe you, man.
You don't know nothing.
Get out of here. Let's get back to the show. Can't believe it. Ladies and gentlemen, we are back. I am Vince Elliott. She is Erica Mack. Yeah, because I know she's going to talk in third person anyway, so I might as well just go ahead and say who she is. We are, I got to be on the top side. Yeah. Anyway, so we are back with my guest, Dr. Tiffany Zare Yelda. In fact, let's make sure we get that name up there. There we go. And she has been telling us about eye health, eye care. We've talked a lot about misconceptions. We've talked about things you can do, how often you should go visit your doctor, all types of things. So if you just joined us, you want to make sure you go to subscribe to our YouTube page, which you can search for The Vince Elliott. Subscribe, hit the notifications bell, like, of course. But what you can do once you do that is you get notified when we go live or when we come with some other form of content, whether it's Lil V or whatever. And then also you can go back and watch what you missed. You go back and watch what you missed today or some other shows, because we got all types of topics that we talk about. But today we're talking about eye care. eye disease. We're going to be talking about further in the show how she can detect, meaning our good doctor here, how she can detect what's going on in your body just by looking in your eyes. That's very interesting to me. And so I want to get into that if we can and go right into how is it that you can look into my eyes? It's almost like you see it into my soul and see what's going on and what I'm eating and all that type of thing. Talk to me about that. Why is it that you can, or how is it that you can look into a person's eyes? Explain that, please.
Yeah, so I always say my big thing is the eyes are connected to the whole body, and that it really shows when we look at the eyes how the body is one. So certain things that we see in the eyes, diabetes, high blood pressure, heart disease, different types of cancer, lung cancer, breast cancer, HIV, leukemia, brain tumors, high cholesterol. We see it all in the eyes. So
wow.
Yeah, I always say you can lie to us about your health history. You can tell me everything's perfect. You can't hide it. We will see it.
Wow. All that just by looking into the eyes. Yeah. So that's a little bit different than the, now that makes sense. So when I go, if I were to go to the psychic person and then he look into my eyes and be like, I see you have some type of, they're really an optometrist.
Yes. We all have two jobs.
So we're, on your off time, you put on a different robe and then you put something on your head or whatever, and you go and you change your accent and your crystal ball, and then you just make money. I see. I got that. Okay.
Yeah,
so I guess I want to go ahead and put this eye picture up and ask you to explain what's happening between these two eyes that you're showing. So go ahead. Yep.
Okay. So this is an Optos image. This is a wide view photo of the back of the eye or scan. So a couple little things that we really look at. I like to use this as a tool with my patients. I pull it up right in the exam room and we go over the back of the eye together. So I show you exactly what I'm looking at, what I see. And so circular structure in the middle kind of looks like a donut, the bright area. That's your optic nerve. That's where we look for glaucoma, swelling, and bleeding. Darker area next to that on each eye, that's your macula. We look for that macular degeneration, again, swelling and bleeding there. Swelling and bleeding at these two areas are going to indicate something uncontrolled: diabetes, high blood pressure, heart disease, tumors, fluid on the brain, things like that. All those blood vessels should have blood, which in these two photos they do, and they should not be leaking blood. Leaking of blood in those areas, depending on the type of leakage, again, is going to indicate diabetes, high blood pressure, fluid on the brain, something else going on. And then all the way out to the periphery that's where we look for all those other changes. So retinal holes, tears, detachments, a lot of those which have no symptoms. And then we also look for all those changes, again, associated with things like breast cancer, prostate cancer, HIV, leukemia, and many, many other diseases. So these two pictures that we're looking at today are nice, healthy eyes. This is what you want your eyes to look like. Anything that strays away from the normal here is of concern and would prompt us to educate the patient and say, hey, we need you to get additional testing, whether it be a blood workup, an MRI, a CAT scan, depending on what we see in the back of the eyes, or glaucoma workups, all based off of everything that we see right here.
Wow. Not so sexy from that angle. You're looking at somebody's eyes, she's batting her eyes, she's going, yeah, she looks great. But then you look at that angle, it's like, okay.
Yeah.
Very different.
Yeah.
So there are we spoke on this, but there are people who have like rings around their eye, and those rings are sometimes like a gray blue or blue. What does that say about that person and their health?
Yeah, so typically that's going to mean that there is high cholesterol, whether that was high cholesterol in the past that's now controlled with medication, diet, whatever you and your primary care physician have come up with that regimen. Or it can mean that there's high cholesterol that's not being treated. So anytime I see that blue ring, I do ask, I double check meds. What meds are you on? Is this something being treated? When was your last physical? When was your last blood workup? We need it to be sooner, or if you're on track, this is great. But those rings do indicate high cholesterol in the body.
That doesn't go away.
Does not go away. Once it's there, it's there.
So, that leads to a question that I have is, are there certain, things or diseases, that you see through the eyes or let me say it this way. So if you have, your sight is, you're losing your sight, or, you need glasses, and, are you going to need glasses for the rest of your life? What can you do to reverse it? Or is there surgery available that can fix the problem? And, talk to me about that.
So it really depends on what's going on. For example, glaucoma is very treatable, very manageable. We can manage it great where you may never lose vision. It's not reversible though. So if you've let it go, you don't use those drops the way we recommend, you can lose permanent vision permanently. Other things like cataracts, cataracts is a big myth. I tell patients, oh, you have cataracts. And they go, oh, my mom had them and I knew this was going to happen. And I say, well, you know what? Cataracts are not necessarily a bad thing. Everyone gets them with birthdays. They come with age. You had enough birthdays to get them. Let's celebrate. But those vision loss from cataracts, yes, that is reversible. We can remove that cataract. We put an implantable lens in. You have great vision, no long-term effects from that. So it really depends on why we've lost vision. Certain retinal bleeds will cause vision loss. Once we clear that bleed up, vision can come back, sometimes to where it started, sometimes just below that. So it really does depend on why is there vision loss. And that kind of goes back to that yearly eye exam, because a lot of these diseases have no symptoms. You don't even know they're in your eyes until it's too far gone. So unless we actually see it there, there's no way for you to know that it's there. The vision loss typically is going to come later on in the process. And at that point, a lot of times it's just too late.
So I think you answered this question earlier, and maybe our viewer, he didn't answer it the way he's asking it, but W. Presley is asking, with all of the online classes and schooling this year, have you noticed more kids with eye strain? Is there anything that can help with that?
Yeah, so kind of like we had mentioned earlier, yes, we have noticed much, much more eye strain, even for kids who don't wear glasses. So bringing them in now is a great time, especially as we do everything online. We do not just online schooling, but homework is online. So, we're talking to kids who are sitting in front of the computer all day for school, and then they have to do assignments right back on that computer.
And then they have to do TikTok too.
Yes, and then they have to do TikTok and Facebook and catch up on their Instagram. So they are on those devices all day, every day. So eye strain is huge right now, and we are recommending, certain glasses to help relieve the eye strain. We're recommending anti-reflective coating, some that block out the blue light from those devices. And then another big thing, which we didn't talk about, is what's called myopia control. And with the myopia becoming more and more prevalent now, we actually have certain things. It's called orthokeratology is the big one. And it's a hard contact lens retainer that kids actually wear at bedtime to slow down the progression of those changes. So there's a lot that we can do preventative as well as while it's happening.
Okay. All right. So let's get into, like where they should go for their first eye exam. Where do you want to direct people to?
To me, no.
Where exactly is that?
Yeah. So we do kind of like I talked about before, we have 5 locations. Ypsilanti Vision is right in Ypsilanti, down the street from Eastern Michigan University, right off the highway. So nice and easy to get to. We have Lake Orion Vision, located just off Lapeer on Indianwood, so down the street from the Palace there. We have 20/20 Family Vision Southfield, that's at 12 and Northwestern. And then the 20/20 Family Vision Farmington Hills, or Professional Eye and Contact Lens, we're at 12 and Orchard Lake. And last but not least, Michigan Eye and Contact Lens on 14 and Novi Road.
Okay. See, so now what they need to do is and if they want to see those locations, if they go to YouTube and subscribe And then that way they can pull up the video and then they can pause it for the location that's closest to them. But we'll put them up a few more times for those,
Absolutely.
So that's great.
So are there any foods that are bad for the eyes?
So we'll talk about what's good for the eyes. How about that? So
yeah,
a balanced, healthy diet. Fatty foods can help. Fatty foods are gonna, be a risk factor for things like macular degeneration. But green leafy vegetables are gonna help prevent macular degeneration. They give the eyes the nutrients that they do need to stay healthy. So we really, really
wait. I'm sorry. Say that again.
Green leafy vegetables. So your kale.
You know what she's doing.
I know. You don't want to hear it, but
she's a rabbit. That's all she eats and drinks. I'm sorry. She drinks her green leafy vegetables.
Good.
Go ahead.
Perfect.
I'm sorry.
Yes. Oh, that's perfect, Erica. But we really, really stress the green leafy vegetables. A lot of people will ask about eye vitamins. The eye vitamins are great for patients who have macular degeneration or who don't necessarily eat a very balanced diet. But if you're getting those green leafy vegetables in your diet, you don't necessarily have to supplement with eye vitamins as well. Carrots, I know you're going to ask about that next. Carrots do not prevent you from getting glasses. Again, they have the beta carotene in there, which is part of the green leafy vegetable group. You can find it in there as well. So yes, they will help keep the eyes healthy, but they do not prevent eye disease or prevent you from having to get glasses.
What is the FamilyEyeDoc.com? What do I find there?
That is Southfield 2020 Family Vision Southfield. It will, if you go to there, it'll route you to the Southfield site. The practice previously was called Family Optometry. So a lot of patients will still know it by that. So we tried to incorporate them.
And I've been to your website. You can go from one location website to another location's website.
Yes.
Yeah.
So if you just remember one of these, you just scroll to the bottom and say, you know what, the other one is closer to me, and click on that one. It'll take you to that website.
Yeah.
That's
and
pretty
sometimes, sometimes too, if you call an office and, we have a lot of times where a patient will say, hey, I was referred to Dr. Zarielda. I want to be seen. And once we start getting patient demographics to add them to the system, we go, hey, you might be closer to this location. Would that be easier? Or a patient may ask, hey, I really only want to see, one of these doctors. Mm-hmm. And they'll say who it is. And this is where I live. And the staff will always help guide you to the location that's going to be the best for you.
Okay. Now, the different locations, do they do different things, or it's for convenience sake?
A little bit of both. Sometimes it is for convenience. They do a little bit of different things. So the Novi, the Michigan Eye and Contact Lens, all the locations will do kids pediatrics. We specialize in pediatrics there. So we see a lot of babies, infants, toddlers, babies who are born with cataracts. We take that cataract out. We cannot put an implant in. The eye is still too fragile. So we actually fit 6, 8, 10-month-olds, 1-year-olds in contacts in that office. So that office, if that was something that we determined you needed in another office, we'd maybe send you there for the actual fitting. All the offices will do comprehensive eye exams. We do have a dry eye specialist on staff, Dr. Krieg. She rotates through most of the offices. So we try to make it as convenient we can for the patients. But they all do kind of, have their own testing, their own equipment that sometimes is a little more specialized than the other offices. But all the offices are capable of doing everything.
And you have a picture that you want to show us, like what that process looked like. And so I just wanted the viewers to be able to see that.
Yes. So perfect.
Oh,
so the one with the blue, that is actually for a specialty contact lens. So that's for patients who may have had, say, like a refractive surgery, a LASIK or something gone wrong, certain eye diseases, extreme dry eye. So that's called the eye print. We're one of the only offices in Michigan that are certified to do this. And it's just like taking a mold of your teeth for a retainer. We take a mold at the front of the eye. It does not hurt. She's actually smiling under that mask. And we get a perfect contact lens designed perfectly for your eye. So it's helped tremendously in a lot of different patients who otherwise would not be able to see very well at all. The other picture with the white probes, that's our TearCare. That's a dry eye treatment. So what that does is kind of like we talked about, it kind of massages those tear glands, and it helps the doctor to express everything out of those glands. And that's for patients with severe dry eye. And those treatments will typically last at least about a year. And you'll get instant relief once that treatment is done.
Wow. So do you have to have severe in order to get that, or like I get it occasionally?
Yeah. So not necessarily severe, but if other things that we're recommending are not helping, then we go to the TearCare. So it's not necessarily a first line treatment. We will try, other things, different types of drops, depending on the type of dry eye you have, what we call a Bruder mask. So we do have different eye washes and things that we would try first, depending on what we see. And TearCare kind of comes down the road, especially when those things are not helping. So not necessarily severe dry eye, but enough that we can see there's a problem, you're uncomfortable, and nothing else is helping.
Now, what about when I'm minding my own business. I'm not bothering nobody. I'm not even out in the elements or anything like that. I'm just chilling, as we say. And all of a sudden, I get this pop in my eye like, man, did I just bust a vessel? What? Somebody hit me with a rock? What is going on that I just got this sharp pain just hit me in my eye just like that? What is that about?
So again, sharp pains are dry eye. So I told you, living in Michigan, we cannot win. But yeah, those sharp pains we get that kind of shoot in the eye, most of the time that's dry eye. Very, very rarely it's going to be like an angle closure with glaucoma. That's more of a red, painful eye. You sometimes can get a shooting pain with that, but 9 times out of 10, if not 9.5 out of 10, that's pretty severe dryness if it's to the point where you're getting those sharp pains.
Now, do you take,
Wow.
I got like 2 questions, but one, I know Erica wanted to ask about the bump on the eye. Did we? Yeah,
I was going to ask, my question with that is like, is that clear bump that, causes your eye to feel like something's in it or whatever, is that from dry eye or allergy, or is that something else?
So the clear bumps we get inside the eye on the white part of the eye, those are typically called pinguecula. Those are from the wind, the sun. I knew it. Yes, I knew that's what you were thinking. Absolutely. Those are typically from wind, sun, things like that blowing across the eye. So it's like a callus on the eye. Once that one forms, we don't really do too much for it. We keep it comfortable with artificial tears, compresses, things like that. But we don't necessarily remove them unless it gets so big it starts to affect the vision. The bumps on the eyelid are commonly known as styes, so chalazion or hordeolum, but we call them styes. And that's from a clogged tear gland. So whatever clogged that gland up, whether it be that it was already clogged to begin with, makeup, dirt, allergens floating around in the air, something clogged that tear gland up, and it causes that stye to form. At that point, we typically treat with warm compresses, antibiotic ointments, oral antibiotics. If none of those help, then we do end up having to kind of surgically excise them. But
okay,
so put a needle in your eyelid.
When you put it that way, yes.
Okay.
So just so I'm clear,
the time we clear it up with the drops, the medications, and the other treatments.
Right.
So I'm clear, the bump that you get seemingly on the outside of your eye, which can be like in the middle or on the side or whatever, that's from a tear gland?
Yep. So just like you can get a pimple out of those pores, you're getting those right on the eyelid. So your eyelid is lined with tear glands. Now,
the one on the inside, it looks like a pimple because it goes white, and I'm a professional pimple popper. So once those things start showing white, I've done that before. Like,
which is fine. You'll get that eye infection next, and you'll come and see me anyway. So go ahead. Do
you take insurance? What kind? You take all types of insurance?
We pretty much take all insurances. All the offices are credentialed with almost all of them. And if for some reason one office is not, for whatever reason, we'll let you know the closest office that is. But for the most part, we take all insurances at all offices. We're able to bill medical insurance, vision insurance, If you do have a medical diagnosis, so anything like dry eye, cataracts, floaters, things like that, that goes towards your medical insurance. So some patients will say, I don't have vision. And I said, that's okay. You have something else going on. This goes towards your medical.
Do you take coins? I need to know if you take coins for payment. Coins. Quarters, dollars, dimes, nickels.
Always, yes. Yes. We will work with you.
Go ahead, Erica.
Lastly, Sherry said that you're great. The team is great, and she highly recommends you all. So that's pretty awesome. You guys are pretty cool.
Well, anytime you get an endorsement from Sherry, you gotta go with that. So.
Yeah. But Naomi said, should someone be concerned if their eyes are worse at night when driving?
So that's very typical. That could mean you have a slight prescription. If you already have glasses, it could mean the prescription may be not strong enough or too strong. And the other big thing is you could have cataracts starting to form. So cataracts, especially at those more beginning stages, we're going to notice it's harder to see in dim light. We always want real bright lighting. We gravitate towards the window. Things at night when the eyes are tired don't seem as clear. You get a lot of starbursting of those headlights. And that typically is a sign of cataracts as well.
Yeah, I need to bring my daughter to see you, and then I'll come too, of course. Cause,
you'll be there anyways. Right?
Yeah, I'll be there anyways. I might as well let you check out the dry eye. But I don't even know why I allow her to drive at night. She goes out. It's just like, she scares me when she says she has a hard time saying, "Don't let it rain." Oh,
yeah. Dark, rainy days. Those are the culprit. So
yeah,
especially with real low prescriptions. Patients will say, I'm good. It's just at night. And I'll tell them dark, rainy days. And how'd you know that? I've done this a couple times, but even though it doesn't seem bad, I'll say, get those glasses, use them as needed. Especially, you talk about your daughter, especially with kids, teenagers, new drivers. I say, you want perfect, crisp, clear vision anytime you're in that car.
Well, you have been a wealth of information. Oh, my goodness. I know my viewers appreciate it. I definitely appreciate it. I mean, clearing up the dry eyes things, the pimple things, the sty thing, the misconceptions, the myths, my eyes aren't getting worse because I'm wearing the glasses, because I promise you, I told my family that. They're like, why aren't you wearing your glasses? Because they're making my eyes weaker. And so now I know I just need to either go talk to us about LASIK. I mean, can you talk about that real quick?
Yeah, so LASIK is a great option. It's not for everybody. You have to have very specific eye curvature, not too high of a prescription, but it is a great option if glasses aren't for you, contacts don't seem to work. A big side effect of it is dry eye. So that's the number one side effect. So that sometimes if you already have dry eye, you may not be a candidate, but definitely a good option, especially, if nothing else is working. So there are specialty procedures as well. PRK, LASIK, and that's for patients with more specialized prescriptions or, corneal disease. But so a good option, not for everybody, but definitely something you can ask about.
Wow.
What is a good solution for dry eyes? What product to use?
So everyone, again, is going to be a little bit different based off of their actual reason for the dryness. Refresh drops are great. Sustain drops are great. Anything that says lubricating is okay to use. Anything that says get the red out or allergy is going to make it worse. So stay away from those. And then, of course, I know I keep reiterating this. Ask your optometrist. Come and see us. We're happy to go over what options are going to work the best for your eyes. So aqueous deficiencies, lipid deficiencies, why are those eyes dry? And let's treat the cause of the problem and not just throw some drops in there.
Yeah. So, well, listen, there's no question that you know what you're talking about. You are definitely the expert. And so we're going to start, just kind of putting up those different locations on the screen so that people can come by and, set an appointment. You guys are taking appointments now?
Yes.
You actually,
yes.
Okay, great. Because I know the COVID, has caused a lot of people to, to shut down and not take appointments. I had to see my doctor, my general practitioner. I had to see him through online, and he was able to diagnose and, and tell me I wasn't dying and send me a prescription.
Good.
So that was great.
We are open. We closed for just a short amount of time. We did open due to our specialty patients. So diabetic exams, glaucoma, the kids, the infants that wear contacts, they needed to be seen. So we did open. We are taking new patients, existing patients, medical exams. We're working. We know not everyone's leaving the house, or comfortable leaving the house with COVID. So we're working with them. We have done some, online consultations or, treatments. We've also scheduled it where we make sure you're the only patient in the office at that time, just to make sure that every patient feels comfortable.
Wow. Well, we appreciate you. Thank you for coming on the show.
Thank you.
Our viewers, I know I can hear them clapping. I hear them cheering and everything. You did an awesome job. And you answered all our questions. We couldn't even trip you up. Excellent, excellent. Well, if there's any last words you want to say, I'm going to give you 15 seconds. Go.
Well, I just want to thank all the viewers. Thank you both, Vince and Erica. I really enjoyed being on here, and we hope to see you all. We're happy to, see you in the office. So come and see us.
Awesome. Well, if you would please stick around for a few minutes backstage, and we will we'll talk to you just a moment. Eric and I are going to close this thing out. Ladies and gentlemen, that is our show for today. That was Dr. Tiffany Zare Yelda, optometrist, and she is, without question, very knowledgeable in her field. Let's go ahead and run those different locations again up on the screen. If you want to go by, and you can't just stop by. I mean, I guess you could, but you really want to set an appointment.
Definitely better make an appointment.
Yeah, because
sure.
you want to make sure that you're able to be seen. So, other than that, the show was awesome. Erica, what do you think?
Yeah. No, I love it. I absolutely love it. I was while we were going through the show, I was thinking you ain't make your appointment for this year. You need to make your appointment. And I know I need to make it because she always fills up really fast. And I'll be like, okay, I'll just wait until she gets an appointment. Then that's when I'll go.
Well,
yeah.
I don't know if you guys going on a different topic, as C. Taylor, who's a supporter of the show. Thank you, C. Taylor, for supporting the show, as you have one of my number one supporters. And I don't know if I said this in the promo, but, it's interesting. Like I said, we have on average, even though you might see the number up there, it might say 15, 13, 20 or whatever people are watching live. People watch without being registered on the how many people are watching, because sometimes
Absolutely.
They won't click, they'll just
Right.
watch,
Yep.
So we have anywhere from on average, just watching live is 150, 400 are watching, and then it'll go to by the time we do the replay throughout the week, it could go upwards 800, 900,000 sometimes, like that. So with all those people watching, it makes it real easy if people are just giving that $1.25 a week or $5 a month.
Yeah.
And so what's interesting is that I think it's not so much that people don't want to give or can't give $1.25. I think sometimes they forget, or they figure, there's probably enough people doing it. I want to let you guys know, and this, again, I always say this not to browbeat people. I just want to make you aware that we are not stacking chips over here. By no means, we have things we have to pay for to keep this show going. And there are actually about 13 people who have contributed at one point since we've been doing this in May. And only out of those 13, only about 4 people who have given more than once. So thank you to all of you who have given. And those of you who want to give, maybe you're supporting in other ways, but I just want to make you aware of that. You're supporting by sharing, you're supporting by watching the show and building up our viewership so that we are in a position to get sponsors on the show. So we thank you guys for that. But Cash App is one way that you can support. If you cannot do it through Cash App, just shoot us an email at thevinceelliott@gmail.com there on the screen, and we'll find another way, maybe through Zelly or whatever's convenient for you. We'll find a way that you can support in some other way. So we appreciate you guys. Just want to let you know that. That's all I got. Erica, you got anything?
That is all I have. As I always say, that we're nothing without God, and this show is nothing without you. So make sure that you subscribe and meet us back here again on next Tuesday at 7:55.
Exactly. We love you guys. Peace.
Thank you.